Well, next on your feed at 5, we are officially in holiday countdown season. 27 days to Halloween. There are 51 days to Thanksgiving, and you see it there, 81 more days until Christmas. Now, as we near the holidays, the CDC is releasing its guidelines for gatherings. Our senior health correspondent, Monica Robbins, joins us now with that and the other top COVID news of the day. Monica, very good afternoon to you.
Hey, Jay, you know, some of these guidelines are simply common sense, and you've probably heard many of them before, and others, they're just not going to work here during a Northeast Ohio winter. So the agency advises the safest way to celebrate the holidays is by having those virtual celebrations, gathering outside in a socially distanced way, or celebrating only with the people in the same household. Now, everyone should wear a mask in areas of high transmission rates and stay 6 feet apart. If you can't celebrate outdoors, they want you to open your windows and even put a fan in the window to circulate fresh air. You know, not sure that's an option here in Northeast Ohio, unless Mother Nature keeps our temperatures above 50 degrees until January. Unlikely. Unvaccinated people, though, should not travel. And remember, those who do, masks are required on public transportation. And essentially, again, these are pretty much the same guidelines as last year. Bottom line, the best way to have a normal holiday celebration is if everybody is fully vaccinated and those who are eligible are boosted.
Yeah, and that's coming for a lot of folks now. All right, so it sounds like the coronavirus dashboard here in Ohio is getting some upgrades, some updates. What new information is now at our fingertips? You
know, data is constantly changing, so a lot of updates to the Ohio Department of Health coronavirus dashboard. First, the case definition has been updated to reflect reinfections. Those who were reinfected with COVID 90 or more days after a previous infection will now be counted as a new case as of September 1st. Another update, as you can see on the vaccination dashboard, how many Ohioans have received their booster shot. We're over 185,000 so far. And that dashboard also delineates between kids and adults. And you saw there another update, a drop-down menu for variants. You can see which variant is predominant in Ohio. Yeah, Delta, still there. And if you need evidence of the effectiveness of the vaccine, the state has been tracking hospitalizations and deaths based on vaccine status. The most recent numbers show 28,000 unvaccinated Ohioans have been hospitalized since January 1st, compared to just over 1,000 vaccinated. And with death, more than 8,000 unvaccinated Ohioans have died, compared to 146 fully vaccinated. So that data really shows you that the vaccines work.
I wish, and you and I have talked about this, at least at last count when I checked, 37 other states make the information on breakthrough cases, not hospitalizations and deaths, but breakthrough cases available. Ohio still isn't doing that, right?
No, but they are doing the reinfection.
Right,
so
that was interesting.
Yeah, that's a little interesting.
But we don't know if that was a reinfection from a virus or from a vaccine or from someone that had the natural antibodies.
Correct.
Okay, is it true? I heard that Johnson & Johnson may have a booster shot ready soon. Is that true?
Yeah, it could happen fairly soon. In a couple of weeks, you'll remember that Johnson & Johnson released preliminary data that their booster given 6 months after the initial shot improved efficacy to 95%, on par with Pfizer and Moderna. And they gave that data to the FDA to review. A meeting scheduled for October 15th to discuss emergency use authorization. However, the New York Times is reporting that the company could request an EUA as early as this week. Wow. Either way, looks like J&J booster is just a few weeks away from becoming available.
Yeah, a lot of this is happening now. It's taken some time, but it's all coming soon.
Yep.
All right, Monica, thanks. Great information.